Hospital. We will not allow our hospital. The words echo like thunder inside Kenya's parliament chamber. Papers fly, voices clash, a nation's trust cracking open live on camera. This is not a random argument between politicians, it's the sound of a public system collapsing under its own weight. A few days ago, Kenya's National Assembly called what was supposed to be a routine session, a review of the Social Health Authority, SHA, the new universal healthcare program, meant to replace the old National Health Insurance Fund. It was meant to bring hope. Instead, it brought chaos. In that room, Health Cabinet Secretary Aden Duale accused several lawmakers of corruption, claiming they secretly owned hospitals and were blackmailing him for money. Moments later, Member of Parliament Antony Kibagendi rose from his seat, shouting, "I don't own a hospital anywhere," and with that order died. The people's representatives turned a public hearing into a war zone of insults, ego, and power. But behind those shouts lies something much darker: billions of shillings unaccounted for cancer wards, without drugs, dialysis patients turned away, and hospitals that exist only on paper but somehow receive millions in payments. What we're watching isn't just political drama. It's a government tearing itself apart over money meant for the sick. And the question every Kenyan, every African, every American watching from afar should be asking is simple. When leaders fight over hospitals, who takes care of the patients? Because this is no longer about Aden Duale or Antony Kibagendi. It's about a system that was supposed to heal and is now killing hope instead. Stay with us, because what's collapsing in Kenya's health sector tonight could happen anywhere. Corruption is treated like routine. And by the end of this video, you'll see why Africa's struggle for accountability may be the world's next great fight for dignity. It was supposed to be a normal Thursday morning inside Kenya's National Assembly, quiet, procedural, and professional. The Health Committee had invited Cabinet Secretary Aden Duale to explain how the newly formed Social Health Authority, SHA, was working. The SHA was designed to replace the old National Health Insurance Fund, NHIF, and finally deliver affordable health care for every citizen, a promise made to millions. But what began as a technical review quickly turned into a political battlefield. Members of Parliament had just returned from inspecting hospitals across 10 counties. What they found was devastating. Machines broken beyond repair, nurses unpaid for months, cancer wards running out of drugs, entire faith-based hospitals collapsing because SHA hadn't sent their funding. One MP described seeing a mother sleeping on a hospital floor beside her sick child. No medicine, no doctor, no answers. That was the state of Kenya's new healthcare reform. When Aden Duale entered the hearing room, the tension was already visible. Cameras rolled, his eyes fixed on the committee panel. Before anyone could even ask a question, he struck first. He accused certain MPs of conflicts of interest, claiming that some of them owned hospitals under review by SHA and were using their positions to protect personal profits. "I will not be intimidated by any member," Duale declared. "I am here in accordance with Article 153 to answer questions, not to be blackmailed." The room went silent for a moment. Then chaos erupted. Antony Kibagendi, the MP for Kitutu Chache, South, slammed his microphone. "We will not allow you to intimidate this committee. You are not above the law." He rose to his feet, pointing directly at the minister. "You and your friends are stealing from the sick." Those words struck like lightning. Duale's voice cracked with anger. "I will not allow you to extort and blackmail this ministry." The phrase extort and blackmail set the room ablaze. MPs shouted over one another. The chair, Dr. James Nyakal, tried to call for order, but no one listened. Then came the breaking point. Duale accused Kibagendi of owning a private hospital that had benefited from SHA funds. Kibagendi shouted back, "I don't own a hospital anywhere. Charge me if you have evidence." He slammed his chair backward and stormed out. The hearing was over. Within minutes, the footage flooded social media. The nation watched as the very people meant to protect Kenya's health system turned Parliament into a circus of shouting accusations and finger-pointing. But beneath that chaos, a darker truth was exposed. Hospitals across the country have been operating without payments for months. Audits later showed that SHA had wired millions of shillings to non-existent hospitals, ghost facilities that had no buildings, no staff, not even a postal address. Some hospitals that did exist were reimbursed for patients they never treated. The system's digital platform designed to track every payment was revealed to have been outsourced through a private contract with secret terms. One shocking clause said that if a dispute ever arose, the case must be settled outside Kenya's jurisdiction, meaning the government cannot even take the supplier to a Kenyan court. So, when Duale threw words like extortion and blackmail, it wasn't just an outburst, it was a glimpse into a collapsing empire of power money and mistrust. The man tasked with defending Kenya's health system is now accused of shielding insiders, concealing payments, and silencing whistleblowers. Meanwhile, those demanding answers, the MPs, are themselves accused of being part of the very corruption they're condemning. And somewhere between those two sides lies the real victim, the ordinary Kenyan, the mother waiting for her child's cancer drugs, the old man turned away from dialysis, the nurse unpaid since June. This hearing was supposed to be about solutions. Instead, it became a mirror reflecting the decay of a nation that can no longer separate governance from greed. As the cameras turned off and the shouting faded, one truth remained. Kenya's social health authority isn't healing the sick. It's becoming the disease itself. The footage didn't just go viral, it exploded. Across Kenya, people replayed that moment again and again. The cabinet secretary shouting blackmail, the MP yelling, "You are the thieves?" It became more than a political scandal. It became a national reckoning. Television stations looped the video. Radio hosts took sides. Hashtags like She exposed, Manch Weo who owns the hospitals, and 9 health money heist started trending across X and TikTok. For the first time in years, ordinary citizens were no longer whispering their frustration, they were screaming it. At the center of the storm stood 2 men, Aden Duale and Antony Kibagendi, both claiming to defend the public, both accusing the other of betrayal. But beyond their egos, Kenyans began to ask the real questions: where is the money, who got paid? And why are our hospitals dying while politicians thrive? Independent journalists started digging. What they found turned outrage into fury. Internal memos revealed that some hospitals had received reimbursements for services never provided, and that entire medical centers listed in Eshe's payment records simply did not exist. One line in the audit summary read chillingly, "Payments made to entities with no physical or operational presence." The media traced those ghost hospitals to shell companies connected to political insiders. It was no longer about one minister or one MP, it was about a network feeding off the nation's sickness. Then came the revelations about Eshe's IT contract. The system managing Kenya's new health database was built by a private company operating outside the country. The fine print in the contract stated that any disputes would be handled under foreign arbitration, effectively surrendering Kenya's right to legal recourse at home. And no one in Parliament seemed to know who actually owned the data, the most sensitive information about every citizen's medical history and identity. That's when the tone shifted from outrage to fear. What happens, one analyst asked on live TV, when your country's health data, every record, every patient is controlled by private interests beyond your borders? Doctors began to speak out anonymously. They confirmed what the public suspected: Eshe was running out of cash. Payments to hospitals were delayed for months. Procurement officers were told to be patient. Nurses were resigning quietly. Some dialysis centers had started turning away patients because the machine is under maintenance, when in reality, the machines were repossessed for unpaid bills. And yet the government's official line was denial. When pressed for answers, the Ministry of Health repeated the same statement. There is no crisis. SJ is on track. But ordinary Kenyans saw the truth in their empty pharmacies and silent corridors. One nurse in Nakuru said, "We are tired of carrying death certificates instead of prescriptions." By now, even members of the ruling party were demanding an inquiry. Opposition lawmakers filed motions for a forensic audit, accusing the Health Ministry of laundering billions through SHA. Civil society groups called for whistleblower protection, saying staff inside the ministry were being threatened or transferred for asking questions. Kibagendi posted on X, "Each time I ask CS Duale hard questions about Eshe, he claims I own hospitals. Why can't he name them? Why can't he produce proof?" His post gathered hundreds of thousands of views. Supporters hailed him as a hero for confronting power. Others warned that this was just another political rivalry. Still, for many Kenyans, something had changed. They had seen with their own eyes how the system reacts when questioned with anger, denial, and arrogance. For once, the illusion of progress had cracked. One viewer commented under the viral clip, "If this is how they behave in public, imagine what happens behind closed doors." That sentiment summed it all up, the feeling that corruption was no longer hidden. It was televised. And as protests began to form outside Parliament, carrying placards reading, "Where is our medicine and accountability?" Now the story had reached its climax. Kenya's healthcare scandal was no longer confined to committee rooms, it had spilled into the streets, into conversations, into hearts. The government could dismiss opposition, it could silence journalists, but it could not silence the mothers waiting in hospital corridors or the people who had finally learned that their suffering was someone else's profit. The fight was no longer about policies. It was about dignity, justice, and survival. And the echoes from that chaotic room were still ringing across the nation, a painful reminder that when public health becomes private business, the sick always pay the highest price. When the shouting inside Parliament stopped, the silence outside began to hurt. In Kenya's hospitals, that silence was everywhere, in empty corridors, in broken refrigerators, where vaccines once waited in the quiet sobs of families told to come back next week. Across the country, hundreds of facilities have either closed their wards or reduced services. Rural clinics now open only 2 days a week. Cancer and dialysis patients travel miles to be told there are no drugs. Some die on the way home. Others never even try again. The Social Health Authority (SHA), once introduced as a symbol of reform, has become the very embodiment of decay. And the people are paying the price not in shillings, but in lives. Doctors have gone on strike in several counties. They demand unpaid salaries, proper medical supplies, and protection for whistleblowers who exposed the fake hospital payments. The Kenya Medical Practitioners Union released a grim statement: "We cannot heal patients when the system itself is sick." Meanwhile, on social media, Kenyans are documenting what they call the silent collapse. Images of abandoned hospital wings, empty pharmacy shelves, and handwritten "no drugs available" signs are flooding Facebook and TikTok. Every image tells the same story: a government that stopped listening. But this isn't just a health crisis, it's a political earthquake. The clash between Parliament and the Ministry of Health has deepened into a full-blown institutional war. MPs say the executive refuses to be held accountable. Cabinet officials accuse lawmakers of corruption and media theatrics. And in the middle of this tug-of-war stands a collapsing public service. For President William Ruto, the scandal could not have come at a worse time. His administration has been struggling to contain protests over high taxes and unemployment. Now, with hospitals failing, his promise of affordable universal healthcare sounds hollow. Even some of his own allies are beginning to distance themselves. In Nakuru, elders gathered under a mango tree talking not about politics, but about pain. One man said, "Our children are dying because they fight for power instead of answers." That line, shared by a journalist, went viral because it summed up what millions were feeling: a betrayal of trust so deep it feels irreversible. Civil society groups are calling for a national health inquiry led by independent auditors, faith organizations, and medical unions. They demand publication of every SHA payment, every contract, every hospital name, transparency as the only cure. But the government's response so far has been to promise internal reviews, a phrase Kenyans now translate as "nothing will change." In Parliament, several lawmakers from both sides are pushing to censure Duale for misconduct and obstruction of oversight. But insiders warn the vote could split the ruling coalition, triggering a constitutional crisis. And then there's the street. Outside Nairobi's Kenyatta National Hospital, young activists are gathering daily, lighting candles and holding posters that read, "You can't reform a graveyard." These vigils are spreading to Kisumu, Eldoret, Mombasa. For the first time in years, Kenya's middle class is marching alongside slum dwellers, doctors beside cleaners, teachers beside patients. What began as a shouting match between two men has become a movement. Because people now understand this fight is not about hospitals alone. It's about who controls the truth and whether ordinary citizens still have the power to demand it. When a government turns health into profit, democracy becomes just another transaction. And when leaders stop answering questions, the people begin to ask louder, not in Parliament, but in the streets. The civil unrest that once simmered quietly under Kenya's surface has found a new fuel in justice wrapped in bureaucracy. And unless the truth is laid bare, the anger that began with a few shouts in Parliament could become the fire that redefines a nation. From Washington to Brussels, the story barely made headlines. A shouting match in Nairobi's Parliament. To most Western media outlets, it was just another developing world drama. But beneath that silence lies something the world should not ignore. Kenya's healthcare collapse is not an isolated failure. It's part of a global disease called unaccountable governance. In the United States, older citizens have seen this story before: the slow privatization of public health, the quiet transfer of power from doctors to data companies, from healers to profit boards. The language is always the same: reform, modernization, efficiency. But behind the polished words, the symptoms match: rising costs, vanishing care, and endless excuses. Kenya's Eshe scandal, in truth, mirrors what happens when nations surrender essential systems to consultants, foreign partners, and digital contractors. The IT firm managing Eshe's national database operates under a foreign jurisdiction. That means Kenya's government cannot legally sue or investigate them in its own courts. Sound familiar? It's the same trap that once tied developing nations to debt contracts they could never renegotiate, only this time it's not money being stolen. It's data, dignity, and control. In Washington policy circles, this pattern is known as soft capture. You don't invade a country. You simply own its systems. You own the software that pays its hospitals, the database that records its citizens, the contracts that define its healthcare. And once you own those, you own the government itself. That's why the crisis in Kenya should matter to Americans, because it exposes the global machinery of dependency, one that's been exported to nearly every corner of the developing world. The same institutions that built these systems, IMF consultants, World Bank advisors, USAID contractors, are often the same ones auditing them later. It's like the doctor prescribing poison, then selling the antidote. Across Africa, however, winds are shifting. In Burkina Faso, President Ibrahim Traoré has taken a radically different path, nationalizing medical procurement, banning external data control, and demanding that every health contract be locally audited. His approach isn't perfect, but it's bold, a rejection of the same structural dependency that's now choking Kenya. When he says we will build hospitals before building resorts, he's speaking not just to Africans, but to anyone watching their leaders trade sovereignty for comfort. Meanwhile, in Europe and the US, healthcare remains a political battlefield. Citizens are told to trust market efficiency even as hospital chains consolidate and insurance monopolies dictate who gets to live. The parallels are chilling. Corruption doesn't always wear African colors. Sometimes it wears suits on Wall Street. That's why this Kenyan crisis is a mirror for all of us. When governments hide contracts, when ministers dismiss oversight, when citizens stop asking questions, that's when democracies decay quietly, long before any dictator arrives. One American commentator wrote on Kenya's Eshe scandal isn't about Africa. It's about what happens when public service becomes private enterprise. And perhaps that's the lesson here: accountability isn't a regional issue, it's a human one. From Nairobi to New York, Ouagadougou to Washington, the pattern is the same: systems built on secrecy collapse. Nations built on integrity endure. So when Africa's young leaders like Ibrahim Traoré talk about sovereignty, maybe it isn't just politics, maybe it's survival. And as the world watches Kenya's health system gasp for breath, one question should haunt every government still hiding behind bureaucracy. If you can't heal your own people, what exactly are you governing for? Night falls over Nairobi. The parliament lights have dimmed, the cameras are off, but the questions remain floating in the dark like ghosts. Somewhere in a rural county, a mother still waits beside her child's hospital bed, hoping for a doctor who will never come. A nurse finishes her shift unpaid, wiping her eyes under the flickering light. A hospital guard locks the door early: no medicine today. That is the real ending of this story. Not the shouting in parliament, not the political hashtags, but the quiet despair of a nation that has begun to lose faith in its own institutions. And if you listen carefully, you can hear the echo. This is not just Kenya's story, it is the world's warning. When a system designed to heal becomes a marketplace of power, ordinary people always become collateral damage. When leaders confuse service with self-preservation, nations decay from the inside out, not with explosions, but with silence. And silence, as we've learned from history, is the most dangerous form of consent. It doesn't take soldiers to destroy a republic, it takes paperwork, secrecy, and a million small denials. Across Africa, that silence is being broken: in Ouagadougou, in Bamako, in Niamey, where citizens are demanding transparency and dignity, not charity. Burkina Faso's President Ibrahim Traoré said it best, "We cannot call ourselves free while our people die waiting for medicine that never arrives." Maybe that's the voice Kenya needs to hear right now, not as judgment, but as a mirror. Because sovereignty is not just about armies or flags. It's about the courage to care for your own, to publish the truth, to protect the weak, to make sure no child dies because someone wanted a bigger contract. So tonight, as you finish watching this, ask yourself, what is the value of a government that cannot heal its own people? If you believe that accountability is the first medicine, share this story. If you believe that truth is more important than headlines, subscribe and stay awake with us. Because what is collapsing in Kenya's hospitals today could collapse anywhere tomorrow if we stop asking questions. And if we let that happen, then the next generation will not inherit nations' only ruins. So don't look away. Not from Kenya, not from Africa, not from the truth. This fight for dignity, for health, for sovereignty belongs to all of us.